Dr. Perry from Stop Chasing Pain. In today's video, we are going to discuss with you what I think, honestly, is probably the most important place to assess, release, massage, work, open up to heal any body part in the body. And hopefully by the end of this video, you're going to say, you know what, Doc, I think I'm going to agree with you here. It's really super duper uber important, I call it. And that region is the collarbone region, what they call the thoracic inlet, above the collarbone and underneath the collarbone. I talk about this area a lot because I find it compromised on everybody who comes in to see me in this office. So I'm going to explain to you all the different body systems that are located there and what can happen when you get increased tightness or tension and restriction in that region from maybe past trauma. You have poor breathing patterns, maybe you've had some scar tissue in that area, or just life coming at you and hitting you. So people always say, I mean, how does that area become a problem? And my answer is, well, you're alive on this planet. That's where it's going to hit you. All right. So you'll see me showing on a little skeleton figure down here below, going a check mark through each one of these body systems. And then I'll show you some simple things that you can try to do to make a difference in there. The most important thing that you need to take away from this video is you need to do something to this region. All right. I'm going to give you some of my favorite options, but I want you to explore and have fun and say, well, I wonder if I could do this to it, and do it and then see how you feel. I will tell you to always do both sides. And you may have a little discomfort or pain when you work in this region because if there's inflammation there, tightness or tension, okay? But here's what you need to keep in mind. That's okay, but just make sure that you're not pressing too hard, or if that does have a little discomfort, that it then begins to ease up. If you're doing this and then pain doesn't start to subside, or your symptoms and your pain gets worse, I want you to stop. I want you to back off. There may be more stuff going on for you that you need to look at. Okay? Just follow along with your instincts and what your body is telling you. Okay? So let's move into the next phase of the video where you'll see me explain the systems, and then I'll come back at the end and show you a few interventions. Okay? Here we go. We're going to show you the lymphatics that are going to sit above the collarbone, the veins, the arteries, the nerves, the muscle, and the connective tissue, the fascia. Right here is the sweet spot. Now, I have a program called the Lymphatic Mojo Body Aquarium Big Six that we teach that's, gone pretty viral all over the place because it really works. And you release 6 places in the body where you have the most congestion of lymphatics and blood flow. And I'll give you one guess where spot number 1 is. Right here at that thoracic inlet. So there's a reason we go here first. Because to us at Stop Chasing Pain, you always have to release this area first before you touch and treat anywhere else. It's that important. This is the clavicle / collarbone, and this is the sternum bone right here. This is your first rib right there, okay? Now, this is the thoracic inlet. Now, this would basically be your thoracic region. This is your cervical region, your neck region, and this is the inlet right here. This is the space, in my view, is probably the most important place that you need to look at, assess, and release for tightness or tension or restriction in everything that resides here. It is, I can't even tell you how powerful this place is. All right. So we're going to go over what's located in this region, system by system. All right. So let's go over, first of all, the fascial part. All right. Now, fascia is connective tissue, right? And that's pretty much everywhere in the body. But we're going to talk about a specific type of fascia known as Simpson's fascia. Now, I'm going to represent that fascia by this little blue band / thing like this, where the fascia is going to sit over this inlet, kind of like that. Okay, this is way bigger than it is. It's going to sit pretty much like right here. And then that fascia is going to be horizontal this way. So it acts as what they call a pressure diaphragm. It controls the difference in pressure from the neck to the thorax, and it physically attaches to what's called the cupola of the lungs, covering of the lungs. So that's a big deal. If this fascia gets really, really tense and really, really tight, it can choke off or compromise the fluid flow systems in this area here and compromise breathing. So Simpson's fascia is a huge thing that we want to work. And when we show you the self-help thing at the end, you can be able to get a piece of that. Now, let's talk about the lymphatics, which is one of my favorite things. It's going to be represented kind of in green right here. You've got all the lymphatics in the body. You're going to come up to this thoracic inlet right here through these lymphatic ducts. And the lymphatics for here will dump into the veins of the body at what's called the subclavian vein. We'll show you that in a second. Sub means below, clavian, clavicle here, and then that's the vein system going to be going back towards the heart, okay? Now, when the lymph comes from the body, the majority of it is going to go to the left-hand side here. So 75 to 80% of all the lymphatics in your body dump into the left side area here of that inlet going into the subclavian vein. The other 25% is going to drop here on the right, all right? So normally you'll see more swelling on the left-hand side than the right-hand side just because of how much lymph dumps in here, but not always. Okay, the big thing you need to know here is that if it gets a lot of tightness and tension in through here, all that lymph is going to backflow up towards the brain and the neck and backflow down towards the hands and the feet, and then you're going to have lymphatic swelling and issues like that. All right. Now, what else sits here are bones that can interfere with the drainage here. One of the biggest ones is you have an issue with the clavicle. Maybe you've had a hit to the clavicle, maybe you've had a break to the clavicle, you've had an impact with the sternum or the ribs in through here. You have tightness or tension. Maybe there's even a scar running down your sternum here or in your neck if you've had any kind of surgeries that are done. That's going to compromise the flow rate down here in this inlet going of stuff going in and stuff going out. So past trauma in this region is a big one. The other one is the first rib here. A lot of times from impact on sports or the rib cage or trauma, this first rib elevates up a little bit, so it comes up more towards the neck, and then that can trap off some of that flow in here. And a lot of people may get what they call thoracic outlet syndrome or TOS, where you compromise the nerve or vascular flow in this region that we're going to talk about in just a second, that you can get tingling and numbness of pins and needles down inside the arms on one side or both sides because you have an elevated first rib right here. That's actually quite common. Or you have something with your spine. Maybe you have a cervical spine or upper thoracic spine issue where the bones don't move so well and they need some more mobility in there, and they will compromise this inlet too, because there's a front part and then there's a back part. That's what makes that inlet, right? Okay, so we've gotten the fascia, we've gotten the lymphatics, and then we've got the bone, and now we want to work into some muscles. Right now, there's a lot of different muscles in this region. So, of course, you have the muscles in your neck. A few big ones in here are the sternocleidomastoid muscle that runs along the side of the neck and is going to attach to the sternum and the clavicle. And you've got your scalenes that sit here, and of course the muscles in the front of the neck here, the superficial and the deep stabilizer ones in here. But one that I'm going to talk about that's often neglected or not even thought of is a muscle that sits underneath the collarbone here called the subclavius. Sub means below, clavius for clavicle. The subclavius muscle sits right here, and that can get really, really tight and tense, and it also attaches to that first rib, so we can pull that first rib up in this region, and then you get clamping down here, tightness and tension, and then the lymph is already compromised, and the the flow coming up of the arteries and veins can be compromised too. So when we show you in a little bit, just simply massaging underneath that collarbone right there can be a huge deal. Or what we'll end up doing is placing a vibration ball. This is my Mojo vibration ball right up underneath the collarbone there. And that can help relieve the tension and tightness that's around this inlet. Okay. Now, what do we have left? We have some arteries. Now, the arteries I'm going to represent in red, of course. Now, this is big right here, everybody. This is really, really big, so you have to pay attention. This is the only place where blood is going to come out from the heart that's going to be able to go up to supply your brain with blood flow and oxygen. You have two primary routes for that. On the left side and right side, you've got coming off here of the subclavian artery. All right, you have an artery and vein here, is going to be the common carotid. Common just means that it's going to split at some point. So you have a left common carotid and you have a right common carotid, and these will split off to become external, which means it's going to go to the outside here, and then internal is going to go inside to supply the brain. So you've got the common carotid that's going to go and turn into the internal carotid. Now, can you see if you get compromised down here with tightness and tension, that might be a problem. Yep. Then along the side of the neck, you're going to have what's called a vertebral artery, and that runs in between the sides of the vertebra here, and it also supplies the individual vertebra here. That's going to run up, and it's going to give you your brain blood flow towards the back of the brain underneath here, back in this big hole opening called your foramen magnum, and that's going to be the primary blood flow to your brain stem and cerebellum in the back. Okay, but that also branches off down here, that subclavian artery down below. And I'm going to tell you now, if you get tightness and tension here, you can compromise both. Now, let's talk about the veins. Now, the veins are darker because they don't have any oxygen in there, so this is going to be representing the veins. So you have your subclavian vein that sits here on the right and on the left, okay? And this is going to take all of the vein flow that's coming from up top down into here. So you've got what's called your external jugular vein that's out here, and then the internal jugular vein that's the primary route from draining the brain down to go into what? The internal jugular vein goes into the subclavian vein. And right here is also where the lymphatics that we showed you before, they will dump into the subclavian vein as well. And then that will go back out through the arterial system at some point. Okay? And then you have another one on this side. Okay, now the subclavian vein, and a lot of lymph nodes that surround that jugular vein right here. Okay, so really, really super important. And if that gets compromised, then you have an issue with being able to have good vein drain from what? The brain, right? That's kind of like a super duper uber big deal right there. Now let's talk nerves. Obviously, you're going to have your spinal nerves that are coming off here on your cervical spine and your thoracic spine. But coming up on the right side and the left side, you're going to have what's called cervical sympathetic ganglia. And they're going to send those sympathetic kind of fight or flight signals up in towards this region here. And that's important because the sympathetics control the size of the pipes for delivery of lymphatics and veins and arteries. They're going to control vasospasm. Might make things big or make things small. But you've got what's called the superior cervical ganglia, the middle cervical ganglia, and the inferior cervical ganglia. So you'll get a lot of issues down in here and this inferior cervical ganglia that can mess up everything from here up. Kind of a big deal. Now, there's a few big nerves that are running down into your torso to go below to your organs and a muscle underneath here called your diaphragm. Two of them I'm going to talk about in particular. The first one is running very close to this part of the collarbone right there, and that's your vagus nerve. So you have a right vagus and you have a left vagus. So they're exiting from the skull, going down your neck to right here on the right and here on the left, and that's going to wrap around the esophagus, and that's going to exit like right here along the left side down below at the stomach. Okay. Then you have next to that, you've got another nerve that sits next to it here. So if I kind of represent it like this, let me make this easier for you. This would be the vagus, and then right here would be what's called your phrenic nerve. Now, your phrenic nerve is a powerhouse because that nerve is going to come from the neck, cervical 3, cervical 4, cervical 5. And then that phrenic nerve travels down, and it's going to be the motor nerve, which means the movement nerve, to your diaphragm. So that tells your diaphragm to contract and relax, because it is a muscle, and that's the nerve that does it here. Now, imagine that you have tightness or tension and restriction right here, or you have puffiness and swelling and inflammation because your lymphatic system's backed up. Then I know that every single thing that I just mentioned to you this whole time is going to be compromised, okay? Particularly that vagus nerve and that phrenic nerve. So that's why this area, you need to do some type of release, massage, vibration, opening up and creating space in here, no matter what you have. So we do these for everyone. All right. I mean, there's a lot of stuff there, right? Now we're going to move into some very simple things that you can try to open this area up to help you. Okay. 1, 2, 3. Here we go. All right. How cool was that, right? I mean, the skeleton there, call him Bob. He's pretty awesome, right? Now, what can you do to this region? First of all, the thing I want you to look for here is just if there's puffiness or swelling or inflammation above those collarbone regions. You'll know it when you see it. If you look at enough collarbones, it'll just pop right out to you if it's there. If that's there, that means there's significant inflammation in there. And every single one of those systems that I told you about before is compromised, and something's going to go sideways for you at some point. Trust me, it's gonna. Now, what can you do? All right. Now, simple. One of my favorite things that I always talk about are vibration ball therapy treatments. So I always show you when we use our Mojo vibration ball. This is the one we make. You can certainly pick a different kind of vibration ball from Amazon, or if you have one, that's great. Just get one and start using it. Okay, now this is when people usually ask me about using the percussor guns, the one that you pull the trigger and it's like a jackhammer. I don't really like those around this region because I find that they can be a little bit too aggressive for the type of patients that I see who are already having a lot of discomfort or pain, who are already in what they call sympathetic dominance, where they're in fight or flight. They can't take a lot of forcible treatment, even though it feels good when they're doing it, because the body can't tolerate it. All right. But you go by how you feel. The vibration I like the most. I simply take the ball and I put it underneath the collarbone. I start on the left side first most often because this is where most of the lymph drains. And the harder I press in, the more deeply it vibrates. Start on the low speed first, then work your way up to the highest one over time. Keep it there for 30 seconds to a minute, just as you breathe normal. You might cough. If you cough, that's a vagus nerve stimulation. That means your vagus nerve got stimulated and you cough. And then just take it off if you cough. All right. That means you're done on that session. And then we do the other side right up underneath the collarbone. There's like a perfect space that fits for it. Hold it there in that region the same way. Okay. Now, if you don't have a vibration ball, or you do the vibration ball, you can also work in this area by hand. So what you'll do is you go underneath the collarbone first. Now, the reason you want to go underneath the collarbone first is you want to stimulate and release that subclavius muscle we talked about before to get it to relax. So then this automatically relaxes above. So this is where below comes first. Take your fingers and go underneath the clavicle, collarbone, from outside near where the shoulder is, scraping up underneath, coming towards the center until you can't go anymore. Then do the same thing on the other side. You can lift your shoulder up, you can roll it forward, you can create a little bit more space in there to get up underneath for that muscle. After you do that, I want you to go above the collarbone and gently massage there. I want you to go in different directions: circles, spirals, rotations, front to back, side to side, diagonals, things like that. Okay. Just don't cause pain when you do it. You can also kind of lift up your shoulder a little bit and roll it forward to create space in that region. Now, listen, it's okay if you press in that region with a little bit of harder pressure. I know the lymphatics drain there, but you have to keep something in mind. If this area is not as delicate as you may have been led to believe, okay? This area is designed to take a beating, right? If it took this much pressure from a general massage to shut down how stuff flows in here, it would be impossible for you to wear a backpack for any extended period of time because everything would explode. Same thing with carrying a purse on that region here, right? Anything that comes over here, if that's a lot of pressure sometimes, okay? It's designed to take pressure. It's just not too much pressure. So don't kill yourself getting in there, or too much pressure for too long. You follow? Okay. So if you press in there too hard, sometimes there's nerves that sit in there. You can get little zingers down your arm. So if you have that, what is that telling you? You're doing it too hard. Back off and go lighter. And always remember the fundamental rule: more isn't better, better is better. And always do both sides whenever you work them. That's going to free up that fascia, that Simpson's fascia that we talked about, relieve pressure in these scalene muscles that run along the side. And you can see my sternocleidomastoid muscle popping out here that we talked about before, right? And you remember the nerves that come down at the collarbone here. You've got the vagus nerve right here, closer to the throat. Out here, you've got your phrenic nerve, right? Okay, just kind of review. And then here are your what? Your common carotids. Then on the outside, you've got your vertebral arteries here. Then coming down the neck from the brain is going to be the internal jugular vein, dumping into that subclavian vein right here. And that's where the lymphatics dump. Right? Major, major important. Now, we can create space in this region by doing a couple things. Let me give you some options. You can absolutely do what they call like shrugging up and down like this, because when you come up, you create space. When you go down, you close it. Space, close, space, close. Now, you don't completely close it, but it's opening it up. You can see how this, when I roll forward here, it opens up, then it closes down. You can also begin to do one at a time and kind of shrug them like this, right? Those are great, but those are, and I like that, and they're active, which is great, but sometimes you need to do passive. So what I like to do is, it's like if you find a table or a counter, something you can lean on with your elbows. So I'm going to do my both sides at the same time. First, if I lean into the elbows, I just sink down a little bit, then this naturally relaxes. And it'll just chill right there for a second. Make sure your mouth is closed, and the tip of your tongue, the middle of the tongue, and the back of your tongue are stuck up to the roof of your mouth, so you're not like this, because then you're going to clamp everything down, right? And just chill right there for a little bit, about a minute or so. Now you can combine these. So I'm going to do my right side first, where I'm going to lean on the table, sink into it a little bit. So now the weight is on the right elbow. There's a little relaxation and space here, so I don't have to do the shrugging, you see? And now I'm going to rub above the collarbone and underneath the collarbone. I can get both at the same time. I mean, how cool is that? And I can even use my vibration ball at the same time. Then I would switch to the other side, prop the weight, relax it up, rub below, rub above, do both at the same time, or use the vibration ball like this as you breathe in and out through your nose. And there you go. And then the next questions I get are, how long should you do that for and how often? It's very individual. So just start off once a day and see how you feel. And just start off for a couple minutes when you do it. There's no magical perfect time zone for rubbing a space or doing the vibration, because it changes based on the individual, and it can change even based on the day. You may be able to tolerate more yesterday than you did today, simply because you had a more stressful day today overall than you did yesterday, so your system just can't take a lot, right? That's how it works. This is where it comes in to just really get comfortable paying attention to how you feel when you do it. Okay, and I think you'll likely notice after this, things begin to feel a little bit better. Less pain, less discomfort. You'll probably be breathing a little bit better. You'll start to improve blood flow to and from your brain. You'll start to drain the waste more efficiently from your brain, because that's where it ultimately goes, down below here to the subclavian veins. How cool is that, right? All from working in this region. And you may even notice that, Doc, this is the craziest thing in the world, but you know what? I did that and I feel better in my back. I feel better in my hip, my knee, my foot, my toe, my pinky, all over the place, because this is a major inlet to an outlet, honestly, to the rest of the body. Okay? Thank you so very much, everybody, for tuning in. Make sure you check us out on stopchasingpain.com, where we have a ton of workshops designed to teach you how to feel better, heal from chronic pain and inflammation, and it's available to all humans. And we have our membership site as well, and a lot of ways that you can learn to feel way better than you do now. Okay? Thanks so much for tuning in. This is Dr. Perry from Stop Chasing Pain. We'll see ya on the next video.